I could give you many, many more details on my medical condition, but that is not why I'm here today. Today I'm here to ask, I'm here to plead, I'm here to beg to give me the chance and 78,000 other lives the chance to live. By no fault of my own, my body was chosen for my soul. To experience this beautiful life for as long as I am blessed to. As of right now, for as long as Idaho legislators will grant me. 78,000 other souls are facing the same fate. Our lives are in their hands. That's very true. I actually have spoken to many legislators on this issue, but one of them told me that they don't know what I expect of them. They do not have a magic wand to wave to fix everyone's problems. And I would like to say to every one of them, you're right, you do not, and not everyone in office is supposed to fix everyone's problems, but you do have a pen, and you can sign a piece of paper, and you can save people's lives, and that's what this is about.
And troubles me about people caught in the gap. It is that attitude that if you are poor, if you just tried a little harder, you would and could succeed. Have I told you that for the last 15 years I've struggled to get through undergraduate and graduate school after working 14-hour days that often included caring for a chronically ill husband and now a daughter too? I've done this because I believe that getting an education will lead my family into prosperity, light, and hope. Have I told you that I'll graduate with my master's degree in just another few months? You have an idea of us that is all wrong. People on the Gap are dealing with incredibly difficult circumstances that have long-reaching effects every day, and we're doing all that we can to manage those circumstances. We are fighters. We are tough. I've spent years standing before you asking for your help and your compassion, when perhaps I should have been showing you the strength, determination, endurance that each of these people has shown in the face of great adversity. Because in every way, we are Idaho too. Thank you for your time.
My husband and I are small business owners in Canyon County. Sorry, I'm a little nervous. Middle class, overtaxed, overregulated Americans. I want to be very clear. I believe we have a moral obligation to care for those in need, our vulnerable citizens. We honor our duty to care for them. However, we cannot support and adamantly oppose expansion of government-funded services for those who are less than vulnerable. Putting able-bodied citizens on free government-funded, that is taxpayer-funded healthcare is not the solution. Please consider alternative solutions that empower people to be actively involved in their healthcare. Don't create more dependency. The easy path here is government Medicaid expansion, but it's not the correct one. No doubt the allure of Washington, D.C. money is enticing, and that's understandable. I would urge you to be pioneers, stake out a different path, and let Idaho lead the nation in healthcare innovation.
Later, I'm still uninsured, and my kids are no longer kids. Now they're hardworking, uninsured adults. At almost 52 years old, being without healthcare has taken a toll on me. A couple years ago when the Obamacare thing was offered, I almost had felt like I had hit the lottery. I was finally going to be able to have access to maybe some affordable health care for myself and my family. But wow, that kind of didn't turn out very well.
I'm here to talk with you today about jobs and reinforce the impact of closing the gap, that closing the gap would have. The jobs that would be created by allowing the investment of federal tax dollars in Idaho, the opportunity to grow the economy in an area that has momentum, that provides people with good paying jobs that require higher education, rather than other opportunities in Idaho that are low-wage, low-skill jobs.
This year alone, our family has endured 2 surgeries and several minor procedures. Making the decision to have these procedures was like deciding to put on shoes in the morning. Never once did I wonder how much it would cost or how we were going to pay for them. I did not have to agonize about whether I needed to delay any of these procedures because I had no medical coverage. I cannot imagine being put in that kind of position. I cannot imagine living with that kind of fear. And now is the time for that moral vision, to put our people first, to lead with love and compassion alongside economics, with the courage to know that lives will be saved and Idaho will be stronger for it.
I carry the weight on my back of these 78,000 people on a daily basis. I think of them every day. Any of them that I have met, ones I have not met. That's not my responsibility. I was not elected to office to have that responsibility, but since they won't take that and they won't give us the hope that we need, I'm going to take it for them until they do.
Just, thinking that each story that is shared, each story that is written and read, each prayer that is offered, each testimony given, is a drop of sand on the scales that we hope slowly shifts the scales until the decision is made and the people living in the gap can have health coverage and wraparound services. And so that's, I guess the hope of today is another drop in the sand to slowly try to tip those scales. And we'll keep trying to drop our sand in and tell our stories until that happens.